Okay, so it's Rob Hegley. This is an instructional video about the assessment form that we use in the Lipid Clinic at London Health Sciences Centre. So this form, the format of this form mirrors an electronic database that we've been maintaining for about the last 17 years, and it's in Microsoft Access. And so really the fields that you fill out here manually will be transcribed later on and put into similar fields in Microsoft. So when the patient arrives, height, weight, blood pressure lying, blood pressure standing, waist circumference, hip circumference, pulse lying and standing, the nurse or the clinical assistant will be getting these, but sometimes it would be good if you get them yourself and if you want to check the blood pressure yourself on the patient. Patient medications are the next field that we fill in here, and then you can add any extra medications that don't fit into this list, or sometimes the patients bring the list of medications. Adverse drug reactions, so no allergies or yes, and then you can specify them down here. Previous lipid lowering medications are here, so often patients come in, they've been tried on previous medications. The non-modifiable risk factors, so this reminds you about age, sex, ethnic background, family history of lipid problems, family history of atherosclerosis. Modifiable risk factors here reminds you, oh yeah, lipids are a modifiable risk factor, and then you can list the results here, even from a couple of dates if that comes in on the consultation note. Hypertension, if yes, how long? Smoking, if yes, how long? And oh yeah, the secondary causes that contribute to hyperlipidemia, diabetes, through the use of oral estrogen or oral hormones, not as common, but still some patients will come in and they can raise the triglyceride levels. So, menopausal status, hypothyroidism is associated with high LDL, also high triglycerides sometimes. Obesity, patient's activity level, stress level, alcohol consumption can really raise triglyceride levels, so we want to get the alcohol history, any history of previous surgeries. And flipping over to page 2. Page 2 is really a combination of the medical history and the functional inquiry. So here, it's organized by organ system. So for instance, the cerebrovascular system, N is no problem, S is significant finding, or yes. So this is really no and yes. So for instance, if the patient has had a TIA, you would then check yes, and you would write the year in here, so say 2014, and then just a very brief description. Left-sided TIA resolved spontaneously, and then just a signature there. Any other findings that are not covered by the ones that we have listed that we wanted to collect, so there's a blank line there for you. So for cardiovascular history, this is atherosclerosis, myocardial infarction, CABG, percutaneous intervention, any other procedure here related to cardiovascular system, and then other cardiac manifestations. And then the respiratory system, similarly going all the way down, all the systems. These are ones that we're particularly interested in collecting, but anything else obviously you can add. ENT, skin lesions, endocrine, and then I'm just going to move to page 3, but it continues here the same way. You can see the urogenital, musculoskeletal. The other thing that we calculate are the risk algorithms, risk engines. So the one we like, part of the guidelines, is the Framingham risk engine. So you can go online and enter the patient's variables. You can get them the absolute risk and relative risk. There are other ones. There's one called ProCam, which we don't use, and then there are things like the cardiovascular lifetime risk and score and the pooled cohorts equation. But really, for sure, the one we like the best is Framingham. And then finally, on the back page is a place for you to do your physician's notes. So here you would do your history and physical in the format that you are the most comfortable with. And we're trying to keep it limited, so just to try to keep it focused. Within the lipid clinic, things that we're specifically interested in are the physical stigmata of hyperlipidemia, so corneal arcus, xanthelasma, xanthomas on the skin, xanthomas of the tendons, so specifically commented on, lipemia retinalis for high triglycerides, and then cardiovascular exam, including the heart, precordium, carotid arteries, peripheral pulses, and then anything else. If the patient's diabetic, the kind of exam that you would do for a diabetic and so on. And that would all fit into this space. And then when you are ready, just come and get me and we'll go over the patient together, and then you would dictate using the hospital dictation system. So that's our introduction.